Here's a detailed explanation of heart rate regulation, including 1. Normal values and variations. 2. Mechanisms of heart rate regulation, intrinsic and extrinsic. 3. Cardiovascular homeostasis in exercise. 4. Cardiovascular homeostasis in posture changes. Heart rate, regulation of heart rate. 1. Normal heart rate and normal resting heart rate, HR. Age group, heart rate BPM. Newborn, 0 to 1 month, 100 to 160. Infant, 1 to 12 months, 100 to 150. Child, 1 to 10 years, 70, 11 to 17 years, 60 to 100. Adult, 18 plus years, 60 to 100. Trained athlete, physiological variations in heart rate. Factor, effect on HR. Reason, age, HR with age, maturation of autonomic nervous system, females, males, smaller heart size, hormonal factors. Sleep, HR, increased vagal tone. Exercise, sympathetic activation, O2 demand. Emotion, stress, adrenaline release. Temperature, HR with fever, increased metabolic demand. Body position, HR on standing, reflex compensation for gravity. Regulation of heart rate. A. Intrinsic regulation. The SA node acts as the natural pacemaker. Automaticity. The SA node generates action potentials without external stimulation. Impulse conduction path. SA node, AV node, bundle of his bundle branches, Purkinje fibers. B. Extrinsic regulation. Extrinsic control involves neural, hormonal, and reflex mechanisms. I. Autonomic nervous system, ANS. Component, effect, mechanism. Sympathetic nervous system, HR. Positive chronotropic effect. Releases norepinephrine, binds to BPA1 receptors on SA node. Parasympathetic nervous system, PNS. At HR, negative chronotropic effect. Vagus nerve releases acetylcholine, binds to M2 muscarinic receptors on SA node. Balance between SNS and PNS determines resting heart rate. I. Hormonal control. Hormone, source, effect on HR. Epinephrine, adrenal medulla. HR and force of contraction. Norepinephrine, adrenal medulla, and SNS. HR thyroxine, thyroid gland. HR by increasing sensitivity to catecholamines. E. Baroreceptor reflex. Baroreceptors in carotid sinus and aortic arch detect BP changes. If BP rises, baroreceptors fire more, PNS, SNS, HR. If BP falls, baroreceptors fire less, PNS, SNS, HR. This is crucial for short-term regulation of blood pressure. IV, chemoreceptor reflex located in carotid and aortic bodies. Detect changes in O2, CO2, and pH. Hypoxia, hypercapnia, or acidosis stimulate late SNS to improve perfusion and gas exchange. V, higher brain centers, center, function, medulla oblongata, cardiac control center, cardio-inhibitory and cardio-acceleratory centers. Hypothalamus influences HR through temperature and emotional states. Cerebral cortex, conscious influences, e.g. fear, anticipation. HAR3, cardiovascular homeostasis during exercise. Goal, maintain oxygen delivery to tissues and remove metabolic waste. Changes during exercise, parameter change mechanism. HR, SNS stimulation. Stroke volume, SV, increased venous return and myocardial contractility. Cardiac output, CO equal HRSV, matches increased tissue demand. Blood flow, redirected, vasodilation in muscles, vasoconstriction in GI, kidneys. BPEAT, to maintain perfusion. O2 extraction, more oxygen extracted from blood. Mechanisms, muscle pump contracts veins, venous return. Respiratory pump, changes in thoracic pressure aid venous return. Increases HR, SV, and vasoconstriction. Benefits, supports muscle metabolism, enhances thermoregulation via skin perfusion, maintains MAP, mean arterial pressure. 4. Cardiovascular homeostasis during postural changes. From supine to standing, initial effect, blood pools in lower limbs, venous return, SV, CO, BP. Compensatory responses, baroreceptors, detect fall in BP, reflex in SNS, in PNS. Result, HR vasoconstriction, BP maintained. Orthostatic hypotension occurs if compensatory mechanisms fail. Symptoms: dizziness, lightheadedness, fainting. Causes: dehydration, autonomic dysfunction, medication side effects. Summary table: factor, mechanism, HR response, exercise SNS activation, metabolism, HR, standing up, baroreceptor reflex, HR, vagal dominance, HR, increased metabolism, fear stress, hypothalamic stimulation, catecholamines, CHAR, blood loss, BP, reflex SNS activation, HR. Conclusion: heart rate regulation is a dynamic and finely tuned system involving intrinsic pacemaker activity and complex extrinsic controls through the autonomic nervous system, hormones, reflex arcs, and higher brain centers. During physiological challenges like exercise and posture changes, the body adapts to maintain cardiovascular homeostasis, ensuring proper perfusion and systemic function. Let me know if you'd like a diagram of these mechanisms. Here is a detailed explanation of the applications and implications of heart rate regulation to nursing practice, focusing on 1. Normal values and variations. 2. Mechanisms of heart rate regulation, intrinsic and extrinsic. 3. Cardiovascular homeostasis during exercise. 4. Cardiovascular homeostasis during posture changes. Application and implication to nursing. 1. Normal values and variations. Applications to nursing practice. Vital sign monitoring. Nurses must understand normal heart rate ranges for different age groups to assess patient stability. Baseline assessment. Establishing a patient's baseline HR helps detect early signs of deterioration. Recognizing deviations. Identifying tachycardia, 100 BPM, or bradycardia, 60 BPM, helps nurses intervene early in conditions like sepsis, heart block, or drug toxicity. Nursing implications: pediatric versus geriatric care. Awareness of age-specific HR norms prevents misinterpretation. Patient education. Educating patients on factors that influence HR, e.g., caffeine, stress, exercise. Documentation. Accurate and timely recording of HR for continuity of care and clinical decision-making. 2. Mechanisms of heart rate regulation, intrinsic and extrinsic. CHASH. Applications to nursing practice. Medication management, beat blockers, HR via sympathetic inhibition. Anticholinergic drugs, HR by blocking parasympathetic activity. Emergency response. Understanding autonomic control helps nurses manage bradycardia, e.g. via atropine, or tachycardia, e.g. vagal maneuvers. Patient monitoring in critical care. ECG interpretation and rhythm analysis require knowledge of SA node, AV conduction, and autonomic influence. Nursing implications. Autonomic dysfunction. Common in diabetic neuropathy or spinal cord injury, requires HR and BP monitoring. Vagal stimulation risk. During procedures like rectal exams or suctioning, nurses must monitor for bradycardia. Educating patients on HR-altering factors, stress, dehydration, fever, or medications. 3. Cardiovascular homeostasis during exercise. Applications to nursing practice. Cardiac rehabilitation. Monitor HR response during exercise to ensure safety. Educate patients on target HR zones for safe exercise. Postoperative care. Encourage early ambulation while observing cardiovascular response. Chronic illness management. Teach patients with hypertension, heart failure, or diabetes how exercise affects their HR and BP. Nursing implications. Exercise intolerance. Identifying signs like abnormal HR rise, chest pain, or syncope. Vital sign interpretation post-activity. HR should return to baseline within 10 to 15 minutes after exercise. Delayed recovery may indicate cardiac dysfunction. Encouraging physical activity. Nurses should promote safe physical activity for cardiovascular health and rehabilitation. 4. Cardiovascular homeostasis during posture changes. Applications to nursing practice. Orthostatic vital signs. Measure HR and BP in supine, sitting, and standing positions to detect orthostatic hypotension. Fall risk prevention. Elderly or dehydrated patients are at higher risk. Ensure safe transitions and hydration. Postural training in rehab settings. Nurses play a role in conditioning patients after prolonged bed rest. Nursing implications. Recognizing signs: dizziness, lightheadedness, pallor, or rapid HR upon standing require prompt intervention. Medication monitoring. Antihypertensives, diuretics, or vasodilators can exacerbate postural hypotension. Adjust dosage or timing with the healthcare team. Patient education. Teach slow position changes and hydration to reduce symptoms. Overall nursing implications. Area, nursing role, assessment, accurate HR monitoring, interpretation and reporting deviations. Diagnosis. Identify altered cardiac output, risk for falls, or activity intolerance. Planning. Develop individualized care plans addressing HR regulation. Intervention. Administer medications affecting HR, educate patients, monitor responses to exercise or positional changes. Evaluation. Reassess HR and related signs to determine effectiveness of interventions. Conclusion. Nurses play a critical role in observing, interpreting, and responding to changes in heart rate across various clinical contexts. Understanding the physiological regulation of HR, including intrinsic pacemaker activity, autonomic control, and compensatory mechanisms during exercise and posture changes, allows nurses to deliver safe, effective, and evidence-based care. This knowledge supports accurate assessment, early detection of complications, and personalized interventions that enhance patient outcomes. Thank you. Have a nice day.